What's up, guys? Hey, Jared Beckstrand here, doctor of physical therapy, postpartum fitness specialist, mommytummyfix.com, and today I wanted to share with you 5 of my favorite exercises that you can do either prenatal or postpartum to fix your low back pain. Let's get into those right now. All right, hey, thank you so much for joining me today right here on Tone and Tighten. I feel like kind of first things first, right out of the gate, congratulations are in order. I'm assuming that if you're watching this video, it's because you either are pregnant and have back pain or recently gave birth and have back pain. Regardless of what your current situation is, congratulations. Honestly, as a postpartum fitness specialist, just pregnant and recently postpartum women are probably my absolute favorite population to work with. There's just no greater reward. I was able to help my wife rehab different problems through 4 of her pregnancies. Since then, thousands of women I've been able to help out. And in my opinion, you guys are just absolute rock stars. I mean, it's absolutely amazing. Unfortunately, it does take a toll on your body, so kudos to you for being willing to sacrifice that for your child. I think it's absolutely amazing. It's a special thing. And so thank you for being here. Thank you for joining me today. I hope that what I share with you helps some of you out of the pain or discomfort that you might be experiencing. If it does, do me a huge favor, hit that thumbs up button. Also, if you haven't done so already, there's a red box right down there, says subscribe on it. Click on that subscribe button just so you never miss a new video from Tone and Tighten. Okay, so let's talk about low back pain for a second. Let's talk about prenatal and postpartum low back pain. Now, the interesting part about back pain is it's a symptom, not a diagnosis, meaning you don't just get low back pain. There's some underlying cause that is eliciting that low back pain. Now, in this particular population, it's typically one of 2 reasons. It's either going to be core weakness. Let's be honest, your core kind of gets wrecked with pregnancy. You've got that baby, it grows, it's supposed to come back down. It doesn't always do that all the way. Your core strength is probably lacking a little bit. And then the other issue that I see all the time is mobility. We just need to get things moving the way that they're used to moving, the way that they normally should move again. So that is my goal with the video today. I want to share with you 5 of my favorite exercises that are going to help your mobility in your back and in your hips, and then also to increase core strength the right way to hopefully help you out of some of the pain that you might be experiencing. Let's get into those right now. So one quick thing before we get started, let's just make sure that we have your doctor or nurse or midwife or whatever your healthcare providers go ahead before we get started with some of these exercises. Obviously, safety first, and your health and that baby's health are the most important things. So let's just go ahead and make sure that these are safe for you. Go get your doctor's clearance before you start some of these exercises. Okay, so that said, let's get into some of these stretches. So the first stretch that I love is going to be just a nice, simple, I call it a single knee to chest. You're just going to lay on your back with your legs extended, bend one knee up, interlock your hands around that knee, and then you're just going to use your arms to pull that right into your chest. As you bring it up, you're going to feel a stretch right down here in your glutes, and then if you're tight in your lower back, it might even sneak up into your lower back. I would hold that position for about 20 seconds, and then I'd let it go, and then I'd come up here, and then I'd do that same thing with the right side. Hold that one for 20 seconds and then let it go. You're going to repeat that one 3 times. That's our single knee to chest stretch. Next is going to be a lumbar or a lower back rotation stretch. Same position, you're going to get on your back, but now we're going to bend our knees up. Kind of phase 1 with this is I tell people with both your knees bent, keep your knees together, keep your feet together, and then you're just going to drop both knees over to one side. So right now I'm dropping over to the left, but then I want to keep my shoulders down. So don't let your shoulders roll with your knees. Try to create some separation between your shoulders and your hips. So I'm going to keep my shoulders down flat, and then I'm going to rock both knees over here. That's to the left. I'm going to hold that for 20 seconds, bring them both back up straight, and then I'm going to drop them both down here to the right, keeping again the shoulders flat through the upper body, and I'm going to hold that for 20 seconds. I'm going to repeat that 3 times. Okay, so now let's introduce a little bit of some core strength or some low back strengthening exercises. The first thing that I love is going to be a posterior pelvic tilt with an abdominal brace. So to get into that position, I'm laying on my back with my knees bent. Right now, you guys probably can't see it very well. Sorry, black shirt on a black table. But I've got some space underneath my lower back here. I can get my hands underneath my lower back. That tells me that I've got my hips rocked forward in what we would call an anterior tilt. What I want you to do is rock your hips backwards into a posterior tilt, by pressing your lower back down into the mat. So if this is an anterior tilt, my back is up off the mat, I'm going to rock backwards into a posterior tilt, and now my back is flat against the mat. So that is going to set our hips up and our lower back up in the right position. Now what we want to do is introduce what we call an abdominal brace, or a TRA activation, or a transverse abdominis activation. You've got a muscle, it's your deepest core muscle, that wraps from your lower back around to right underneath your belly button and kind of down the front. It's the muscle that when activated, it sucks your back, or it brings your stomach in. It's the muscle that you use to kind of suck everything in tight. I call it your corset muscle. We want to activate that muscle while we're in this posterior pelvic tilt position. So to do that, we're going to get into the posterior pelvic tilt, flatten the back, and now what I want you to do is focus on using your muscles to bring your belly button in towards your spine, and then you're going to hold that for about a 3 to 5 second count. A lot of times people will just kind of breathe in when they do this. That's not what I want you to do. So a lot of times what I'll even tell people is, let's flatten your back, let's breathe all of our air out, and now bring that belly button in towards your spine. It doesn't need to be a big movement. It's very subtle, but it is very effective if we can train and strengthen that transverse abdominis muscle. So to do that real time, I'm going to flatten my back, breathe all my air out, and then I'm going to pull that belly button in towards my spine. I'm going to hold that for a 3 to 5 second count, and then I'm going to relax. One more bonus is that if you can throw in a Kegel to this as well, or a pelvic floor contraction, or a pelvic brace, that's going to be even better. So flatten your back, tighten your tummy up, so draw in that navel, and then also focus on that gentle lift or that gentle contraction of your pelvic floor. Hold that for 2-3 seconds, and then we're going to repeat that up to 10 times. If 10 feels good, do 10 more. If 10 more feels good, do up to 3 sets of 10 of that posterior pelvic tilt with the abdominal brace and with the Kegel contraction. It's going to be an amazing exercise for you. Next exercise is going to be some bridges. This is probably my favorite way to activate your lower back muscles and your glute muscles at home. The glutes get weak, the lower back muscles get weak. This is a great exercise for those if we do bridges. Laying on your back, knees bent. I even like to tell people, let's start with a TRA contraction. So let's start by actually bringing that belly button in towards our spine so we can get that contraction. Now what we're going to do is squeeze with our glutes to lift our hips up towards the sky and then come right back down. And so TRA contraction, so hold that in, squeeze the glutes, lift the hips up, hold 1, 2, 3, and then come right back down. So TRA contraction, suck the belly button in, squeeze the glutes, lift up, hold 1, 2, 3, and then come right back down. Same thing, start with 10. If 10 feels good, do another set of 10, up to 3 sets of 10, just once a day on those bridges. Okay. Finally, our deep hip rotators often get weak, or our glutes even often get weak with pregnancy, and so and with childbirth and with the recovery period afterwards. And so let's show you some clamshells. If you have any SI joint pain going on, this is one of my favorite exercises for that as well. I'm going to lay down on my side. So right now I'm on my left side. My knees are on top of each other, my feet are on top of each other. What I'm going to do is fire these deep hip rotators to just open up. I'm going to separate my right knee off of my left knee, hold that for a 2 to 3 second count, and then come right back down. Clamshell up. Basically your knees just kind of form this clam who is opening and closing his mouth. I'm assuming that's where they got the name. We're just going to go just like that. So we're going to open up, hold 1, 2, 3, and then close it right back down. Do a set of 10. This would be on my right leg. Do a set of 10 on your right leg. Roll over onto your right side to do the left leg. Do a set of 10 of those. And again, if that feels good, work up to about 3 sets of 10 each direction on those clamshells. And there you have them, you guys. So those are 5 of my favorite pregnancy and then also postpartum exercises to help you to treat your low back pain. That problem typically arises from a lack of mobility and a lack of strength. These 5 exercises address those issues. I showed you 2 of my favorite stretches. I showed you 3 great exercises that are going to fire muscles in your core and around your core and in and around your pelvis to hopefully help you out of some of the pain or discomfort that you might be experiencing. Hope that helped you guys. If it did, be sure to hit that thumbs up button. Also, if you have any questions or comments about this video or even suggestions for future videos that you'd like to see from me here at Tone and Tighten, please leave those in a comment down below and I'll get to those as soon as I can. Hey, thanks so much for watching here on Tone and Tighten. If you haven't done so already, click on this circle button right down here to subscribe to my channel here on YouTube. If you're looking for some great stretches to alleviate neck, upper back, and lower back pain with pregnancy and afterwards, that's a great video for you right there. Down there, there's one more that you guys might enjoy. Thanks again for watching here on Tone and Tighten. We'll see you next time.